So, what are the key clinical red flags in primary care, ophthalmology, dermatology, and GI that should trigger a high index of suspicion for spondyloarthritis referrals?
Right, so totally number one, the hugest red flag, the most common complaint is that of back pain. I know back pain is very, very common, but this back pain is what we call inflammatory back pain. So you feel it in the lower back, and you might have it radiating into the buttocks. This sort of inflammatory back pain is worse at night, it is worse at rest, is associated with morning stiffness that may last for greater than 30 minutes to an hour. That's the type of back pain that persons typically complain of. It's better with exercise and then non-steroidal anti-inflammatory drugs such as naproxen or ibuprofen really help to alleviate this back pain. So this is what we call inflammatory back pain. So that's the hugest red flag. Other associated symptoms that persons may have, which sometimes may even precede or be more prominent to the patient than the back pain is, as you mentioned, they may have like inflammation of the eye, so uveitis. The uvea is that colored part of the eye, so they can have inflammation, redness, pain, visual disturbance. They can also have psoriasis or family history of psoriasis. Psoriasis may also precede joint pain or back pain. Persons may also have inflammatory bowel disease, which might look like fever, weight loss, abdominal pain, blood in the stool, diarrhea, constipation, and all of these really are part of the whole spectrum of axial spondyloarthritis and all its associated conditions.
Wonderful. And in terms of classification versus diagnosis, how much weight do you put on the ASAS criteria in real world practice? And where do you see them misapplied, if at all?
Yeah. So, the difference really between a classification criteria and a diagnostic criteria is that a classification criteria is a strict rule and it's pretty, it's used really for research purposes to ensure that you are enrolling a homogeneous or a group of people that look alike into a research, project. So that's what a classification criteria is. A diagnostic criteria is what we can use to diagnose people, so some similarities, but still a bit of nuances. In rheumatology, a lot of patients, we use our classification criteria sometimes to help us to diagnose, but a lot of patients will not necessarily meet the classification criteria, but will still have the diagnosis. So we don't really have a diagnostic criteria for the axial spondyloarthritis, but we use our clinician gestalt or basically just knowing that each person is different and person's symptoms and signs develop over a spectrum of time. We as clinicians who see these diseases very often, we can determine that let's diagnose this person with this disease. So I wouldn't say that I would say that I do use the classification criteria, right? But if someone doesn't meet all of the points of the classification criteria, that's still okay because by our clinician experience, we could still diagnose the patient with that, knowing that everybody is different. Human bodies don't read textbooks all the time, right? So I hope that answers that question.
Yeah.